Welcome to The Art of Intelligence, where we decode the future of AI, one story, one use case, and one bold idea at a time. I'm your host, Barlas UJ, inviting you to join me and industry leaders as we explore how artificial intelligence is reshaping our world from the boardroom to the classroom and beyond. Now, whether you're an innovator, a skeptic, or just AI curious, this is your front row seat to the real conversations and practical insights behind the buzzwords. Let's paint a bigger picture together. Hello, everybody. Today, I am honored to be joined by Dr. Lavie, an internal medicine specialist from Haifa who is combining frontline clinical practice with advanced work in digital medicine and artificial intelligence. She has developed and specialized clinical decision support, GPT-based agents training on leading resources like Harrison's Principles of Internal Medicine, guidelines, and top journals to help physicians make faster evidence-based decisions at the point of care. Beyond her AI work, Dr. Lavie's philosophy is healing from the inside out, with a strong focus on nutritional medicine, preventative care, and holistic well-being, and she's currently pursuing an MSc in digital medicine. I'm excited to explore how she sees AI transforming clinical decision-making and doctor-patient relationship and future personalized care. Welcome, Doctor.
Thank you, Barlas. Thank you for having me.
Fantastic. Doctor, before we get started on your background and your clinicals, if you could answer a question that we ask all of our guests, which is, if you could have any vacation to anywhere in the world and money was no object and babysitting was no object, where would it be?
Well, babysitting is important. I think it would be Hawaii. If I could run away, yeah. I think it would be
Hawaii
Hawaii.
sounds like a nice day. I enjoy Hawaii myself.
I'm sure. Well, for me, it sounds like a distant fantasy for the time being. Hopefully, in the future,
Maybe one day. Maybe they'll have a medical convention, an AI medical convention in yeah. Doctor, can you give us a little background on yourself?
Sure.
Basically, where you've gone to school, all of those wonderful things.
Sure. Well, I studied in Tel Aviv University and Bar Ilan University in Israel. That's where I graduated my medical degree. I then had a specialty in internal medicine in one of the hospitals in Haifa, Bnei Zion. We have 3 hospitals in Haifa, actually. I'm continuing to a subspecialty soon after my maternity leave. I'm now on maternity leave in intensive care. And I am now doing my master's in digital medicine, as you've said, in Tel Aviv University.
Fantastic. And have you always been in Tel Aviv? Have you ever come and hung out with us in the U.S.?
I have been in the U.S. several times, but I think the last time was over 10 years ago, 2014, I think.
Wow, been a while. Okay, all right.
Been a while.
That's fantastic. Time for a refresher. Can you give us a little bit of background on how do you currently describe your role as a clinician, digital medicine researcher,
Sure.
AI builder, or maybe something of a combination?
Well, I think of myself as a hybrid physician, because I think in order for me to be an AI researcher and a clinical tools builder, I need to have the background and to know from the field what are the pain points, what needs to be improved, is it feasible, what could be achieved, because many things are not optionable. Sometimes people make suggestions that are not feasible, like to our clinical skills or like workflow, let's call it. It's not realistic. Doctors, as a people, sometimes we find it hard to get accustomed to new systems. That's why we need to perform a transformation, which will be will go smoothly in the workflow and will not interrupt us and will not be heavier than what we already have, because if it will, it just won't work. So I think of myself as a hybrid physician, which is one of the reasons I decided also to go to intensive care unit, which is one of the places that I think AI and digitizing could really assist. Let's put it this way. And I love the
Nice.
action. Yeah,
I bet it seems like it would be constant.
yeah,
Um,
and adrenaline.
Let me ask you this: What was there a moment in your career where you were doing internal medicine and you said, you know what, an AI tool could do this easier, better, faster? And if there was, what was that moment?
Well, actually, I finished my residency in 2024. Was present, but still, not really like used. The moment actually came to me when I was in hematology. I spent a year or so in hematology thinking that would be my future as a hematologist. And that's where I felt the need, because I was sitting with patients and I needed the information to come quickly, and I still studied it. I didn't feel like that I was fluent enough in the materials. So that's when I had the aha, where I built the tools. It started from hematology. I have also a hem assistant, which I
Wow.
used and helped me to study. Yeah. After that, as an attending in the internal medicine unit, I built for internal medicine, also to help the residents study. If I had this tool when I was studying for the exams, we have two exams, a test and an oral test. I think I think it would be much better for me to study, because just reading a book, like passively, for me at least, it's not working out so much. But this is interactive. It can also make presentations, journal clubs. It really like can shorten times and help with a lot of day-to-day tasks that we have as residents that are time consuming. And also,
Nice.
of course, present patients. I can present a patient to it, and it will give me like a differential diagnosis, possible workup. Um, yeah, for all from the literature, all from reliable literature sources. Uh, I keep it tight. I keep it very short so it won't hallucinate.
Yeah, hallucinations is always a problem.
Yeah,
I had another guest on here a couple of months back who was talking about healthcare and AI, and the way he described it was AI in doctor work is like being able to talk to 200 physicians with 1,000 years of experience apiece and being able to ask them questions, not to do the job of a doctor, but to make the job easier. Um,
exactly.
you talk
I
about
agree.
healing. What's that?
I agree that it makes our job easier, but I think with all my enthusiasm on AI, I still have some, guardrails I want to sustain, and we'll talk about it.
Absolutely. Yeah, you can't, I mean, AI is not in a place, I don't know if it ever will to be able to take the place of a human doctor just because what is sometimes a clinical decision can be lost. The humanity of it can be lost when talking about possibilities.
Exactly.
What's that?
I can tell you a story that demonstrates this exactly.
Yeah,
I have
please.
many stories.
I would love to hear a story. That would work great.
Well, as an attending physician, I also worked in the ER. And at one time, this older man came by, and he looked like he was dying. There's no other way of putting it. And I recognized it immediately. I don't know if AI would have recognized it by his vital signs labs, because it wasn't as apparent as his physical visibility. And I called the family and I told them, you should come. You should come. And when they came, I told them they should say their goodbyes, um, because any intervention would have just prolonged his suffering. I don't believe in non necessary suffering if it goes nowhere. And they came, and he actually died a few hours later, surrounded by his loved ones. A year or so after, I didn't even remember it. A year or so after, I saw his daughter-in-law, and I didn't remember her. She remembered me, and she thanked me. They remembered me for the better, not for the worse. Although yeah, because I let them have the opportunity to come and say goodbye. And he didn't die alone in a hospital like many other people do, which is very sad. One of the things that for me are the saddest, to die alone in a hospital, which is pretty depressing. Um, and I don't think AI can do that, or I don't think AI should do that. I think
Yeah.
AI should give us the opportunity, to make room for the patients, to do the bureaucratic administrative burden that we have, to lighten the burden of cognitive load. But I don't think it should by any means replace us.
Yeah, I think there has to be a humanity of it. When dealing with, do we do this procedure? It might have a 20% chance of working, but if we do this procedure, it has a 45% chance of working, but the level of life or the happiness will be a lot less because they might be bedridden. AI might make the wrong choice in that. There has to be a human that's going to look at this and make the final
Human in the
decision.
loop.
Yeah, it's just going to have to
Exactly.
be, especially now that we're just definitely not anywhere near a place where AI can do any of this without human.
Well,
Uh,
Elon Musk doesn't think like us, but
well,
but we disagree.
Elon is selling AI, so you can't ever trust the salesperson on their
That's
product
true.
when it comes to what's possible.
A good
Um,
point.
Now, you created the suite of GPT-based clinical decision support agents, including the Intramed Advisor and training on core internal medicine resources and guidelines, as you were saying. Can you walk us through how one of these agents works in a typical case?
Sure. It's really easy. All you have to do is open it on your ChatGPT. Also, it's free. Um, I can send I can send a link. Anybody who has the link can use it. It also has a disclaimer, which is very important because one of the most important things in medicine is the liability issue. It's like an advisor. Okay, I present a patient, like a 72-year-old patient presented with shortness of breath, has been deteriorating for several days, and like his blood pressure is 70 over 50, his fever is 38. I'm sorry, I don't know Fahrenheit, um, and so on. And I give the medical history. I'd like present the patient, isn't his history and his background. And then he just gives me like recommendations of the workup, and of course, like by likelihood, okay, and what labs or imaging or workup should I perform. Um, and for me, he is an advisor. I can also tell you of a story that I had like in my first ER shift as a resident, that I don't think AI could have helped me. I didn't have AI then, but I trusted my gut. I couldn't tell you like what was wrong, but this patient, like, I don't know if AI could have helped him because he had nothing like specific in his labs or anything. So there are many stories. And I think in the end, doctor's experience is very important. And I think it can help us. It can help us. Um, by all the literature in the palm of our hand. That's very, very important because it saves time. But the decision in the end is ours, only ours, and the liability also, for now, at
Yeah,
least.
yeah, for now. Yeah, if
Yeah.
you want to send me that link, I'm happy to put it in with this podcast so that people
Sure.
can take a look at it. That would be really fantastic. Let me ask you
I
a
will.
question about the AI, and this one's going to be a little bit harder. What do
Okay.
you say to people that say that if doctors start using AI to diagnose, that they will rely too heavily on it? And even though they make the final decision, if you have a young doctor that went through medical school, but now knows, oh, well, I don't really have to remember anything because I can just ask
Mm.
AI and AI says, do this, and I know how to do that. So diagnostics will fall strictly to AI, and that experience that you have from not having AI and being able to see things is going to be going away. Can you tell me a little bit
Well,
about your thoughts on that?
yeah, of course, that's one of the things that bother me. And when I said earlier guardrail, that's exactly what I meant. Because one of the scariest things that not AI will help us think is that we will stop thinking for ourselves. And for that, we have to always have a mental practice. Don't let the AI only handle problems. I mean, cognitive discomfort is good, mental workout is good, and we need it because in medicine, nothing is certain. Medicine is not an exact science. Okay, nothing is 100%. Many patients didn't read the book. Okay, so we have to keep an open mind and not be fixated, which is one of the known biases in medicine, by the way. We have several biases, and AI will present another bias in the near future. So I think we should approach the AI only after we thought of it ourselves. Okay, we thought of a possible differential. I use it as complementary differential. Like I don't want to miss anything, but we shouldn't rely on it only. And that will be the critical thinking skill. I think will be the most important skill that we need to maintain. It's relevant to all professions, not only medicine, but of course, especially in medicine, because we deal with people's lives. And that's one of the scariest things, but we need to be proactive about it. And when I come back to the hospital and I'll have students, because I really love to teach, that is one thing that I will be insistent on, like workout for the brain. Don't be afraid of medical discomfort because discomfort comes with our profession. Uncertainty, discomfort, it's part of the profession. You can't run away from it. So you need to face it and don't run away. And I think this is one of the things we have to maintain. And it will, I think it will be hard, but we can do it.
Whose
And
responsibility do you think that it needs to be? Is that responsibility going to fall to doctors like yourself that is going to do the training of younger doctors or newer doctors coming up? Does this need to be in administrators' hands, or do you think that it should be patients that should push back and do their own differential on their own AI systems and then bring
no.
that to the doctor?
Well, actually, that's a very interesting question. I think one of the advantages of AI is that we can empower patients, but it should be done very responsibly, only with reliable sources, not like let's Google it and then Google gives you like the most like irrelevant diagnosis, like doctor, I have cancer, which is like the most, most of the times it's not cancer. Um, I think a new model of liability will be in the future. Um, by the way, I also built a tool for patients in Hebrew, which is
Oh,
called Medical. Yeah, Medical. Kal in Hebrew is easy, so it's called Medical. I
so
haven't published it.
easy medicine.
Yeah, exactly.
Nice.
It relies on the HMO's information and our patients' approaching information. I haven't published it yet because of liability issues.
Mm.
I need to work this out before I publish it. But I think like if a patient, it can help explain lab results, things that are sometimes the doctors, because they work so hard and have so little time, maybe it can help. I think AI should help empower patients have more control of their and knowledge of their file and their health status. I think they should be more involved. I think everything is true, but it needs to be performed in a very responsible manner. And I think regulation wise, we are not there yet. I think that's the thing that like holds us back the most, the regulations and liability issues. That's
Yeah, I can imagine that because if AI is making decisions, who holds AI responsible? Is it the
Who is
designer,
liable?
the person asking the question, the person who didn't ask the right question, or the person who actually does the procedure by blindly following? So yeah, that's definitely a concern. I like the idea of being able to help explain diagnosis to patients in a understandable manner. That sounds really good. Should patients take that information, put it into their own AI, right? Because the Medical has its own uh, learning that it's done through its own kind of systems and AI
That's true.
training. But let's say I take that and go to Claude, and I take the description of what I have to Claude, and Claude says, "Have you thought about this?" How do
I
doctors
think
feel about me coming to you and telling you, "Hey, thanks for my diagnosis. Here's 14 different medicines that we should try
yeah.
because blah blah blah." What is your thoughts on?
Well, first of all, taking your information and putting it, there's privacy issues, which is
Yeah,
part of the thing that we don't exactly. We don't want to. Who will save your privacy? Okay,
yeah,
your information. Secondly, I don't know if you you know this, but most doctors don't like being approached with like
yeah,
40, yeah, because many times, sometimes it's true. Like I always listen to patients, and if they have concerns, I explain to them why it might be relevant, why it might not be relevant. But you know, there are diagnoses we call zebras. What we mostly see is a donkey. It's not a zebra. A zebra is a rare diagnosis. Mostly you don't see a zebra, you see a donkey. So most probably it's not a zebra. Okay?
So when you
I
hear when you
think
hear footprint, when you hear hoofs hitting the ground,
Yahoo's
think donkey, don't think zebra.
exactly. Most of the time it will not be a zebra, it will be a donkey. Um, I think that's why patient education is very important. But one of the phenomena I've encountered on these past few years, especially since COVID, um, is less trust in health systems. I see it also in the US as people react, people's reactions on LinkedIn or on social platforms, and also in Israel, less trust. I think um, we have an opportunity here because AI can change the relationship between the physicians and the patients. Until now, or recently, patients were very trusting, and doctors will just say their diagnosis and their treatment, and patients will go do it. Nowadays, when people are more aware of health, of well-being and health, and being mindful, and are less trusting, we can take this opportunity to build a new relationship where the patient is more involved and aware and informed. And I think it's an opportunity for a new relationship, but it's going to take some time also to rebuild the trust, I think.
Yeah, I think you're very right about COVID and the trust lost with the medical profession since then. It's unfortunate, but
It is.
it has been happening, and I will tell you, a lot of people are turning to AI to do their diagnosis, whether it be right or wrong. We don't have as patients, we don't have the right mentality or training to look at something and type in all the symptoms. Whereas being tired or feet hurting or eyes being red might not seem like symptoms to us, a trained doctor is going to say, okay, these symptoms mixed with these symptoms are what you should be asking, not just your legs hurt or not just this, because it could give you a bad diagnosis and going out and
Yes.
trying to fix it yourself.
At BeWise, we've completely redesigned the beehive using artificial intelligence and advanced robotics. It is our responsibility, as the world's most capable species, to protect our most valuable neighbors here on planet Earth, and by that, protect the entire world. Our autonomous beehive, the first of its kind, monitors every bee, providing them with real-time care and support. We are revolutionizing beekeeping and saving billions of bees' lives. To save the bees, we don't need to think outside the box. We need to reinvent the box.
Isn't going to
Exactly.
be the easiest. But, you know, in the United States, medical is expensive. It's,
Yeah,
I don't know how it is in
I know.
Israel. I'm Turkish, and you know, we take care of our elderly. Everyone over 65 gets free medical. There's clinics that help Turkish folks out, and then there's of course the rich that have their private doctors. But in the United States, it's very much a very expensive thing where, you know, for a family of four, you're paying something like almost $2,000 a month to be able to have access to medical care, and not
Yes.
everybody has that form of money to be able to do it. So unfortunately, AI has become that crutch to help folks that
I
don't have
know.
access.
In Israel, we have a public health system, which is why, my salary is not that high. It's okay compared to the market, but I work as a resident, I worked over 300 hours a month and 26 hours shift, like straight. Um, I don't know if it was worth it money wise. I mean, I'm sure it was not. So we have a public health system. Everybody pays bituach leumi, and everybody are entitled for health insurance. We have the HMOs. Everybody can choose from 4 HMOs, and there's also, of course, private health insurance if you're willing to pay. By the way, one of the things I am now investigating in my master's degree is the difference, how is digital transformation occurring in a public health system compared to a private health system. I'm comparing the USA to Israel, which is very interesting because I think a lot of reactions from Americans I saw was like, I prefer AI, so I won't have to pay. But also the thing is, we have to realize is medicine has context. We cannot. An AI doesn't always have the context. It's sometimes like it's ripped. Like I had this patient, like a 30-year-old patient that came to me once, asking for his testosterone result test. I'm like, why did you perform a testosterone? Because I have a lower libido. Like this man was overweight, which can cause like a lower testosterone. And he had the other doctor that was before me gave it to him only because he asked. But if he came to me, I would start with much simpler things like CBC, blood count, and chemistry panel, and thyroid function, like before I got to testosterone. And he didn't take any of those medications, any of these labs. So context is very important. And his testosterone was normal, by the way. And we don't want to perform like extra tests that are unnecessary because it is also harmful. It's not like innocent to perform endless tests.
Sure.
So it'll be interesting to see the differences.
Yeah, I'd like to see the information that you get when you're done with the master's program, just to see the difference between the private
Sure.
and the public. In the US, it's very different. I'm also Canadian. Everything.
Oh,
And in
nice.
Canadian, there is a public funded healthcare system. The problem that we have come up with as a family in the Canadian public healthcare system is that many doctors, not using AI, although I guess it could be a form of it, are going down a list of questions. Have you tried aspirin? No? Go try and come back. Have you tried aspirin? Great. Okay, next. Do you sleep well at night? Do you eat good? No, go do that and then come back in 3 weeks and let's go from there. And it slows things down. Um, what do you say to public health care when you're dealing with that? Do you think that AI will help speed that up, even though this helps the government out, right?
Yes.
Because you're either going to die because you're asking so many questions over 6 to 12 to 13 months, which in Canada, don't hate me, Canadians, but in Canada, cancer is found 80% of the time in the nth stage, um,
Really.
which is not good. Do you
No.
think AI will be able to help with those diagnoses?
I think AI can help with the straightforward diagnosis, not the complex cases. Like I think like for family practitioners or general practitioners, many diagnoses are really straightforward, like urinary tract infections, cellulitis, things that are like I don't think I should prescribe an antibiotics, but I think it can refer to lab results, like general lab results, and it can offload many of the family doctors' work. The more complex cases, and of course, malignant diseases, I think should always be treated by physicians. um, it's really weird to me to hear that Canada has like 80% are diagnosed at late stages. I think some diseases are very evasive, and but by the way, like one of the advantages of AI in radiology is that it can diagnose like pancreatic. This is new, relatively new. Pancreatic cancer finding that doctors can't see with the naked eye, like 3 years earlier, which could be like mind blowing because pancreatic cancer is usually diagnosed at late stages, and mostly there's nothing to do because it's very aggressive. So if we can use this to diagnose it earlier, this could save a lot of lives. I think this has a lot of potential.
Let me ask this question, and I'm not trying to beat you up on medical stuff. I'm just finding this conversation very interesting. But let me ask you this. About 10 years ago, there was something like AI where you could go and have your whole body scanned, and it would tell you that 30 years from now, you have a 90% chance of having a brain tumor. And insurance companies would be like, hey, we're willing to pay this for you. You go, it costs $10,000, but we're such great
Yeah.
people that we're going to pay that for you so you know in advance that you're going to have cancer. And then the problem happened was now that I know you're going to have cancer as an insurance company 3 years earlier, let's say, I can say, you know what, you've got a pre-existing condition. I'm not going to cover your cancer in the United States anyway. In Israel and Canada, it's a different story. But in the United States or anyone with privatized medicine, that becomes an issue because now you've got, pre-existing condition. What do you say to that? And I'm just asking.
Yeah.
I know you're not going to come up with a solution,
No,
but
it's okay. I think
is
this is.
learning 3 years earlier going to help patients in a privatized medical program?
I think in the case specific of the pancreatic cancer we talked about is going to help. I think it will because like cutting like surgery can save their lives like now, not in 3 years.
Sure.
Okay, because the cancer is now there but still hasn't manifested clinically. I think there's an ethical issue around performing like a full body CT or MRI to look for trouble because some we're going to find incidentalomas, okay? Findings that have no clinical significance, but now I know I have like a cyst or whatever in the, I don't know. Okay, it doesn't matter, but I think there's an ethical issue because most of the incidentalomas we'll find have no clinical significance, and also I think the person with the knowing that he might have 30% of developing like a tumor in 3 to 10 years. I think it could be. I don't know. I'm against it. I'm against performing non-necessary tests. Okay, that could lead to more problems ethically and for the person also because we can also find something, but if we can't diagnose it, like I know there's a point somewhere in the intestine, but if I can't biopsy it, I can't know what it is. What is the meaning of it? So when we have cases like that, we do follow-ups. Okay, I want to see like, oh, let's test it in a year. Let's test it, and then we'll see accordingly. Okay, that's what we usually do when there's a finding. We're not sure of its significance, if it's not manifested clinically. That's what we usually do. But it could get us in unnecessary trouble also.
Yeah.
That's about.
I think insurance companies having access, or anytime an insurance company says, I have a free test for you, it should be looked at with, you know, sideways glances. So to get
They care
back to,
about money.
yeah,
Yep. So
they care about money. Well, Israel doesn't have to worry about that for right now. So that's a good thing anyway. As someone who's still actively in internal medicine, where do you see AI making the biggest difference, like 3 to 5 years from now? Like, I
oh,
get
that
it. You have the doctors. Everyone in Israel has to do their mandatory military service, and there's sometimes wars and things like that. Where do you see
sometimes.
AI? Yeah, sometimes. Where do you see AI helping the most? Is Battlefield AI diagnostic something that you feel will be a really great tool for, non-trained doctors that are basically saving people's lives in the field? Is it clinicians? Is it, emergency medicine? Where do you think the biggest impact is going to be?
Oh, that's a great question. By the way, we have like many startups that are doing these things. One of them, of a friend of mine who is a surgeon in my hospital, um, is like it's an automatic arterial. What's the word? I forgot. Sorry.
Or
Um,
plant?
like it could save lives by occlude the artery. Okay, like automatically. So if you don't know how to do it in the battlefield, it does it. It's great.
Wow.
But to answer your question regarding medicine, internal medicine specifically, I have a vision. I don't know if it will happen in 3 or 4 or 5 years. I think it might take longer. Um, I think the hospitals will start from home because one of the great things about AI, it can identify trends, and I think this is what we should use. One of the things we should use it for, like everybody wears these watches today.
Yeah.
I don't know anybody who doesn't wear this watch today, which can
Mine's
tell you
charging right now.
saturation. Yeah, exactly. It can tell your saturation, your heartbeat. I guess some can tell your blood pressure. You can document your weight, and by using these parameters that we know a person's baseline. Let's take like a heart failure patient. Okay, many times patients get discharged from the hospital, and hospitalizations in heart failure patients, um, they raise mortality and morbidity, and it's not good. Okay, so we want to reduce readmissions. Okay, and also they cost a lot of money.
Yeah.
Okay, so if we can monitor a patient after he was discharged and see that he started gaining weight and see that his function has deteriorated, we can in advance like treat him before he comes to the ER and we have to admit him. So I think the the medicine will transform into proactive medicine instead of reactive medicine, which with like capturing the patients before they deteriorate, before they're in a crisis. I think that is the direction we're heading at in AI. I would love to see it and help be a part of it. And I think that will be a great thing because hospitalizations cause complications and infections, acquired infections, and MDRs, which is multi-drug resistant bacteria. And I think in the end, like, and the team has a lot of burden and they burnout, and I think it can help reduce all these things and help maintain a better well-being for everyone.
That's
That's my vision.
that's a great vision. I really like the
Thank you.
idea of having something constantly kind of giving the doctors the information, like the ECG on my watch and the oxygen saturation. Being able to have that and understanding what it's like, a month before someone seeing you gives you a lot of information, gives AI a lot of information to say, hey, look, by the way, every 15 days, this guy's oxygen goes down for some reason. We don't know why. And now you have the information in something that you can look back on and say, this is what's happening. Let's see how we can do a test. So I think that's phenomenal. And I hope that there'll be more of that testing, maybe in old folks' homes or retirement villages that can really have
High
alert,
risk patients, exactly.
yeah, high-risk patients that, maybe um, checking out internal defibrillators to, jumpstart a heart for somebody, anything along those lines, I'm all for. Now we're coming to the end of our conversation, so I'd like to ask you just a couple of questions. One, if you could see AI doing anything, I'm not just talking medical field, I'm talking everything that Gal would like to see. Um, what would be something that either you've seen that is really interesting, would like to see, or have done yourself?
I don't know if it's interesting, but I would love to see it do laundry and
Ah,
ensures ensures that I have less time to do. It's a great question. And I'm actually quite scared of the things it could do. I think it will be even empathetic in the not so distant future. But still, we need to remember it's not a person. And one of the things I fear is our children. This is children that were born since 2025 are the beta generation that will not, they will have no knowledge of what's life like without AI because they are born to it. So one of the things that I'm afraid of, they won't have social connections because still it's not human. So we need to learn how to talk to humans and to understand behavior. We need to talk to humans, not AI. So this is one of the things I fear. But we'll see. We'll see.
well, that's interesting that you say that because earlier when we were talking about your agent, you referred to your agent as him, not as
Oh,
AI.
I did.
Yeah, you did. So
I didn't even notice.
when you were saying you're like, well, he does this and he has the ability to do this,
He's
it's
capable.
already happening. I mean, we're
It
already
is.
equating and assigning a sex to the things. And China has already created a robot that can
I
do a lot of
saw.
these things. Our washing, our dishwashing, our laundry, our babysitting of our children. I mean, I don't know how much of this we're going to actually, take on full time, but it's amazing to think what could happen, but it's also very scary to think, will our children read books? Will our grandchildren even know what a book is? Will people forget how to read because AI is
Exactly.
just telling them things? Like, will creativity go out the door because AI can draw a picture better than a human? Like, there's so many different things that come in with
Totally
it.
agree with you. I totally agree with you. And I think one of the, we talked earlier about skills and critical thinking. I think the people that will be successful in this next generation are the people that will maintain their voice because when everybody have access to the same tools, like what will keep you unique? What will keep you separate from other people? Your voice, because AI can generate new knowledge. It can like integrate knowledge, existing knowledge, but new thoughts, new concepts that will come from our brain. So that's why we need to constantly train our brain and don't be afraid of cognitive discomfort and uncertainty. We need to embrace it and deal with it because it will be good for our brain and
Yeah,
future.
I agree. Um,
Thanks.
Last question, and then we'll let you go. If this conversation was replayed in 10 years, what's the one prediction you'd be happiest to have been wrong about when it comes to AI in medicine?
Um, that it will make people cognitively weaker and less creative and unable to read long texts and deal with complexity and uncertainty and discomfort. That's what I fear the most. And I do think it will happen at a certain amount. I will be very, very happy to be wrong about it.
Yeah, that would be a nice one to be wrong.
Yeah.
So Gal, thank you so much, Doctor. I really appreciate the time and you making the time away from your family. It's later in Haifa than, of course, it is here, and I really do appreciate it. Listeners will have Gal's link in the documents below. Please subscribe and like, and we'll move forward from there. See you next time.
Thank you so much, Carlos.
Thank you. All right, and that's the end of it.
Every conversation we have on this show is a brushstroke. The bigger picture takes time, but it's taking shape. I'm Barlos UJ. Thanks for sitting with us on this one. If today's episode sparks something, share it, argue about it, build on it. That's the whole point. Until next time, stay curious, stay critical.